What are the kidneys? And what do they do? The kidneys lie either side of the backbone, just below the ribs. They do many amazing jobs within the body, including removing waste and excess water. The kidneys also have a role in controlling blood pressure, helping to keep our bones strong and healthy, and controlling the production of red blood cells. If the kidneys are not working properly, waste products and sometimes water can build up in the body. When this happens, a special diet along with specific medicine may be needed. Sometimes dialysis or a kidney transplant may become necessary. A dietitian is an expert in advising people about what diet is best for them. They will help you make changes to what you eat and drink in the best way for you. Energy. It is important to make sure you have enough energy in your diet. You need energy as fuel for your body, just like how a car needs fuel to move. Not having enough energy can lead to weight loss and loss of muscle tissue. You may need to include extra snacks and high-energy foods and drinks if you are struggling to eat all the energy that you need from your current food and drink intake. Your dietitian will advise you on which foods are best. Potassium. Potassium is needed for your heart, muscles and nerves to work properly. We get potassium from the food and drink that we have in our diet. The kidneys remove any excess potassium that is not needed in the body. When the kidneys are not working well, they can no longer remove excess potassium, so the level can build up in the body. This can be dangerous for your heart, so you may need to alter your diet so that it is lower in potassium. This may mean avoiding foods like bananas, mushrooms, tomatoes, potato crisps, and chocolate, which are high in potassium. Your dietitian may advise you to choose foods which are lower in potassium, such as apples, carrots, pasta, rice, chicken, and sweets, such as jelly sweets and mints. There are lots of yummy low potassium foods which you can choose. You may also need to cook foods in a different way, such as boiling all potatoes and vegetables. Ask your dietitian for more information about this. Phosphate. Both calcium and phosphate are needed for strong bones. We get calcium and phosphate from the food and drink we have in our diets. One of the important jobs of the kidneys is to remove excess phosphate from the blood. When the kidneys are not working properly, phosphate can build up in the body, and this can lead to your bones becoming weaker and damage to your blood vessels. You may need to reduce your intake of foods which are high in phosphate and replace them with more suitable ones. Reducing your intake of milk and yogurts and cutting down on hard cheeses and trying cottage or cream cheese instead will all help to reduce your intake of phosphate. Your dietitian will advise you on which foods to choose for a low-phosphate diet. Processed foods such as ready meals, burgers, and some snack foods contain ingredients known as phosphate additives. Our bodies easily absorb the phosphate additive that we eat, and these can cause your blood phosphate levels to increase. As you have just learned, this is not good for you, and we need to prevent this. You can reduce your intake of phosphate additives by eating more homemade foods, rather than having ready meals or processed foods. Another great way to do this is by learning about the information on labels on your food items. Checking labels on foods for phosphate additives is clever and very useful, as this way you will know which foods to avoid and which ones you can have. Why not get all the family to help with this? Your dietitian will advise you on what to look for on food labels so you can become an expert at this. Salt. Salt is in lots of foods that we eat. Having too much salt when you have problems with your kidneys can lead to water building up in your body. This can be uncomfortable, and you may experience swelling in various parts of your body, such as your legs. Your dietitian may advise you to reduce the salt in your diet by cutting out salty foods such as bacon, sausages, Packet noodles and takeaways, processed foods are also salty, so it's best to try and have homemade meals. Fluid. One of the main jobs of the kidneys is to make sure we have the right amount of fluid in our bodies. Not too much and not too little. When the kidneys are not working well, we can end up having too much fluid in our bodies. This can lead to swelling in parts of your body and high blood pressure, which can lead to problems with your heart. You may be asked to limit the amount of fluid you drink to help control this. Luckily, avoiding salty foods can help you feel less thirsty, and therefore this will make following a fluid restriction easier. Your dietitian will advise you on how much fluid you can have, and will provide you with tips on how to keep to this amount each day. Vitamin D. Remember we mentioned about healthy bones? Well, most of us know that calcium is essential for healthy bones. But vitamin D is also very important for our bones. Vitamin D helps the body absorb and use calcium in our bodies. We get most of our vitamin D from sunshine, and we also get some from the food that we eat. The kidneys have an important role in getting the vitamin D to do its job in our bodies. Not having enough vitamin D can lead to weak bones. Your doctor may recommend that you take a vitamin D tablet to make sure your bones are strong and healthy. They want you to grow tall and strong, remember? There can be a lot to remember about the diet for those with kidney disease. Your dietitian will understand this and help you make changes to your diet, while still making sure that your diet is tasty and varied. We hope this video has helped you understand the amazing job your kidneys do, and some of the things you may need to think about with your diet when your kidneys are not working properly. Your dietitian will tell you much more about your diet, and it's important to follow the advice that they provide.